Hi, I'm here with my patient who is 49 years old. He is a Caucasian male in apparent good health. We have already done the health history, which I will summarize for this video. He denies any major illnesses or diseases. He is not currently taking any routine medications, although he does take naproxen, ibuprofen, and Tylenol for pain related to a neck injury, which causes him severe headaches and neck spasms. We did an extensive pain assessment um, and discovered some things that worked for him and didn't, and largely things didn't work at all. So he is to be referred to either an orthopedic specialist or a neurologist for pain management and possible interventions for that. He denies any infectious processes, any problems with his eyes or ears. He does wear corrective lenses for close vision and distance, and we will test that vision today. And has negative past medical history, really, for any problems related to the head, ears, eyes, nose, and throat. He does have seasonal allergies, for which he takes sometimes allergy medicine and Visine. But we're going to go ahead, as long as you're okay with all that information. Is that correct?
Yep.
As you understand it? Okay, we're going to go ahead with the assessment. And we're going to assess the entire head, eyes, ears, nose, and throat, going through inspection, palpation. There's really not much percussion and very limited auscultation. Okay, so the first thing I'm going to do is just look. I'm inspecting the head for symmetry, for lack of tremors. There are no tics. He can keep his head upright. The skull is normal in shape, size, and appearance. It is symmetrical. The eyes do not droop. The ears look clean and normal. There's no discharge or debris coming from them. I'm going to test your facial muscles, if you don't mind. I'm going to have you raise your eyebrows. Okay, can you smile without opening your mouth? Can you puff out your cheeks? And can you show me your teeth? Perfect. Okay, so the cranial nerve function there is intact, which is what we like to see. I'm also going to look at his eyebrows, and they have normal hair distribution. His eyelashes are normal. There's no crusting, no secretions. His sclera are normal, white. There's not redness or jaundice. Pupils are round. I don't see any problems with the lacrimal duct, and the mucous membranes look nice and pink. I'm going to test his pupillary response. Okay. Okay. And test it again to see the consensual response. Okay. And the right one reacts to light. Left one reacts to light. So we have an intact pupillary response. Pupils are equal, round, reactive to light. Okay. I'm going to have you, since I'm playing with the pen light, keep your eyes focused on this popsicle stick, okay? Okay. And the cornea reflects light equally. So that's called the corneal light reflex, and it's great. While we're doing eyes, what happened to our cover on cover chart? It doesn't matter. We'll use this one. Okay, cover on cover is a test for strabismus. This patient has a daughter who has strabismus, so we want to be careful to assess this. Okay, so just look at me. I'm going to cover, uncover, cover, uncover, cover, uncover. And he's supposed to look straight ahead. He does, and there's no turning of the eye. Cover, uncover, cover, uncover, cover, uncover. And there's no turning, except when he rolls them at me. Okay. So we've done that. Let's take a look at the ears. Now, if I had an ophthalmoscope, I would be checking his eye. You can see the optic disc, the retina, the veins, and the arteries. A lot of times you will see, if you see little buckles, you can see hemorrhages, you can see uneven pigmentation, and those would all be signs of disease in the eye. Because I don't have access to that equipment, we are deferring that portion of the exam. And we're going to go to the ear. We're still inspecting. So I'm looking at the outside of the ear, and it all looks pretty normal. I'm going to get my pen light, and I don't see any cerumen. We talked about ear hygiene, and why not to poke the Q-tip in too far, and that was all good and well. Okay, so I don't notice any nodules or anything by the ear, any skin tags, anything abnormal. I'm going to look in the mouth. Okay, actually, let's go to the nares. Let's go from top to bottom. The nose is normal size, normal shape, normal color. There's no evidence of skin cancers or, lesions on the nose. And I'm going to look inside, and the nares look. Can you breathe through your nose with your mouth closed? Nares are patent. Okay. Mucous membranes look nice and moist. There's no deviation. That looks great. Okay. Now we're going to look in the mouth. On the outside of the mouth, I'm looking for cracks, fissures, any kind of blisters, ulcers, and I don't see any. So I'm free to go ahead and look in. Now I'm looking. Okay. And the mouth looks normal. There's good hygiene there. You bit the inside of your cheek. I can see that. Salivary gland is normal. No evidence of any kind of infection. And I kind of take a good look around because he does have a history of tobacco use. The uvula and the palate look pink, intact. Everything looks good. He still has his tonsils. Okay, while I'm in here, let me put your tongue to the roof of your mouth. Looking there for any ulcers. Normally I would be saving palpation for later, but I don't want to keep his mouth open forever, so I'm just going to kind of tap on his teeth. Any soreness?
No.
No. Okay. And I'm going to try and elicit the gag reflex. Okay, yeah. Okay, it's intact. I'm sorry. Okay, and I'm just going to kind of palpate as I'm poking around in here. I really don't like to put my fingers in patients' mouths because some of them bite you. Not this one, but anyway. Okay, so I've inspected the mouth. While I was in there, I did a little bit of light palpation to elicit the gag reflex. And now I'm looking at his neck and throat area. And I'm going to have you look all the way up. And I'm looking here for swelling. Everything looks normal. I don't see anything unusual. I'm going to have you swallow. Good, perfect. Okay, now I'm going to have you're going to swallow. I'm going to look from the side for any swelling of the thyroid gland. Okay. All right, so he's negative for goiter. The hyoid cartilage moves up and down the way it's supposed to. Now I'm going to do some palpation. Okay, first I'm going to palpate the skull and the scalp. Okay, and as I'm doing so, I'm noting that the hair is normal. It's not brittle or dry. It doesn't feel oily or greasy. There's no plaque scales, any breaks in the skin at all. And the bony structures all feel normal. I'm not feeling anything abnormal there. Okay, I'm going to gently palpate over your sinuses. Are you feeling any tenderness?
No.
No. Okay. And I'm going to go back here to your mastoid. Okay, any tenderness there?
No.
Okay. I'm going to palpate. Look up at me. I'm going to palpate right over the eyes. The orbits aren't swollen. Is there any pain there? Pain?
No.
No. Any pain when I palpate over your nasal cartilage?
No.
Okay. Now we're going to go down to the neck. Okay. And I'm going to feel for the trachea. It is midline. And I'm going to do another test for the thyroid. I'm going to have you take a drink, but don't swallow it until I tell you. Now I've got a thumb on one side, and 3 fingers of my hand on this side. So go ahead and swallow. Okay, and that's fine. Now we're going to do it on this side. And you'll see my thumb is right here to the left of his trachea. And 3 fingers are here. So go ahead and swallow. Perfect. Okay, so everything there is normal. I'm going to feel the lymph nodes, the cervical ones, submental, preauricular, postauricular. And everything feels normal. And then I'm going to go to the back. The occipital, yeah, everything feels good there. Okay. So that's our palpation. Okay. Now we don't really percuss much. If you felt any swelling over the thyroid, you can percuss to see if it extends, but that isn't necessary. Okay. Auscultation in the head and neck is very limited, but we're going to do it anyway. So I'm going to sit down. Okay. We're going to auscultate with the bell over the temporal artery. What I do not want to hear is a bruit. which is indicative of turbulent blood flow or flow around an obstruction. I don't hear anything abnormal. I'm going to close your eyes, and I'll put the bell of the stethoscope right against your eye, very gently. And I don't hear anything. Okay, and I can listen over the thyroid. And again, no bruise, and that's kind of what I don't want to hear. So I know that's probably the first time anyone's ever listened to your eyeballs, but it is something. If you had concern about vascular insufficiency to the brain, you would do those assessments. And I think that's sort of, hearing tests. Okay, we're going to conclude our assessment with tests of hearing. We haven't already done it, right? Okay. All right, so I have a tuning fork. This is called the RIN test. Do you hear it?
Yep.
Okay, perfect. Now we're going to go again. This time we're going to go bone conduction back here. Actually, maybe I should come around here so the camera can see it. And then air conduction, we're going to hold it here. Air conduction should be better than bone conduction, but no cheating. Tell me when it stops. Still hear it?
Yes.
Okay, so air conduction was better than bone conduction. And that, the whisper test, and then I'll finish with some tests of confrontation, and then I promise you are done with me. Okay, so the whisper test, I want you to put your hand over one ear and close your eye, and I'll whisper near this ear. What'd I say?
Kitten.
Okay, do it on the other side.
Baseball.
Okay, baseball. The last test I'm going to do is the test of confrontation, and basically I'm going to get right in your face. You're going to tell me, this is a test of peripheral vision, and you're going to tell me when you see my hands, and they're nice and blue, so.
I see them.
Okay. Now I have one hand up, one hand down. Tell me when you see them.
See them.
Okay, and again.
See them.
Okay. All right, and so peripheral vision is intact. And that concludes our assessment for this evening. Thank you. You were an excellent patient.